am Arela, and for today's video, I'll be performing the assessment of thorax and lungs to a patient. Good afternoon, ma'am. I am Arela, your student nurse from San Pablo Colleges. So for today, ma'am, for verification first, can I ask what is your name?
Arela.
How about your birthday, ma'am?
September 30, 2006.
Okay, and your age? 22. Before I start explaining the procedure, ma'am, can I ask what do you want me to call you?
Mariel.
Okay, Ma'am Mariel. What language do you prefer? Okay po. So dito po ay interview ko po muna kayo para po sa subjective data niyo po. Okay lang po ba yun, ma'am? Okay, so for the current symptoms, may difficult po ba tayo sa kanya? Okay po. Any chest pain po? Okay. So wala naman po. Meron po ba kayong ubo?
Wala.
Sa past medical history po, may mga prior respiratory problems po ba tayo? Did you undergo po in thoracic surgery for past months or years?
No.
Biopsy po. Sa allergies naman po, meron po ba tayong tinitake na medicines for allergies or treatment po?
Wala naman.
How about po sa pulmonary study test? Nagkaroon po ba kayo ng x-ray, skin test, or influenza immunization? For the family history po, meron po bang lung disease na history ng family?
Wala naman.
That's good to know, ma'am. Fertilizer and health problems po. Gumagamit po ba tayo ng tobacco products, cigarettes? How about po sa exposure po sa environmental conditions? Meron po ba tayong exposure na nakaka-apekto sa ating breathing such as secondhand smoke? That's good. Sa difficulty naman po, meron po bang time na nahihirapan kayo paghinga habang ginagawa yung mga daily review po?
Hindi naman.
Okay po. In terms of degree of stress naman po, ma'am, nai-stress po ba tayo, ma'am? Hindi naman po. That's good to know. And lastly is for medications po for breathing. Meron po bang mga medications na nireseta or ni-prescribe sa inyo ang doctor? So, for this assessment po, ma'am, I will assess your thorax, particularly to the posterior thorax and your lungs po, i-check ko rin. And for this assessment, I will inspect, palpate, and percuss, and auscultate, or listen to your breathing sounds po. Is that okay with you, ma'am? Rest assured that all of your documents are completely between me and to the attending physician that I will refer to. Okay, ma'am, I'm going to do the hand hygiene. And as you can see, I already provide some privacy in closing the curtains and the door. And ngayon po, kukuhain ko po ang inyong patient's count para po makapagpalit po kayo. Okay po, ma'am, ito po yung inyong patient's count. You can change into it po para po ma-inspect, palpate, percuss, at auscultate po ng maayos ang inyong thorax and lungs po. Okay, so I already told to the patient to change into a patient's count. Also, I already perform hand hygiene and provide some privacy. Okay, so I'll be starting to perform and assess the posterior thorax of the patient. Okay, so for the first one, I'll be inspecting the shape, the configuration of the chest wall as well as the scapula. And also, I will be inspecting the accessory muscle and the posture of the patient. Okay, ma'am, allow me to open it. And please sit straight and put your hands in your lap. And can you please inhale, ma'am? Exhale. Inhale. Exhale. Relax, ma'am. Relax. Inhale. Exhale po. Again po, inhale. And exhale. So for the next one, I'll be palpating the tenderness and sensation. Ma'am, allow me to put the Okay, so I already put the gloves on, and right now I'll be palpating for the tenderness and sensation, as well as additionals if there's any personal issues. Okay, ma'am, let me palpate your back, and please tell me if you feel any tenderness and pain, okay? Here. Do you feel anything, ma'am? No. Also, I'll be inspecting the temperature of the back of the patient using the dorsal of my hands. I will check your temperature. As for the scapula, it is symmetrical and I haven't seen any protrusion. For the shoulder and the scapula, it is equally horizontal, positioned in the back of the patient, and also I haven't seen any signs of kyphosis, scoliosis, or other misalignments of the spinal cord. As for the breathing, when I ask the patient to breathe, I observe that she uses her shoulder to inhaling and exhaling. Also, there is no available lesions in the back of the patient. When it comes to the temperature, as I observed while touching the back of the patient using the dorsal of my hand, it is equally bilateral. Also, it's not too hot and it's not too cold. The patient also said that she has no pain and she doesn't feel any tenderness. Also, I haven't seen or observed any muscle soreness. Okay, so for the next one, I'll be palpating the primitus using the ulnar of my hands. Okay, ma'am, please say 99 when I touch your back, please. 99. 99. 99. 99. 99. For the primitus, I observed that it is symmetrical and I can feel the vibrations when the patient says 99. So it means there is the presence of the vibrations when I palpated it from this up until this. So for the next one, I'll be percussing the intercostal spaces of the back of the patient. So for the next one, I'll be auscultating the bronchophony. Ma'am, kapag po yung stethoscope is tumanggi na say, kasi 99 na po. Okay, for the next one is the egophony. Ma'am, same with the bronchophony. When I touch your back with my stethoscope, you say letter E. Okay, for the last one, I'll be auscultating the whispered pectoral locate by whispering 1, 2, 3. Ma'am, I want you, please whisper 1, 2, 3 when my stethoscope touch your back. So I have observed the resonance, the dullness, and the flatness when I percuss the patient's back.
No.
For the next and last part of our assessment, I'll be auscultating the back of the patient to hear her breathing sounds and observe if there are any possible or any presence of abnormalities in her breathing sounds. Okay, ma'am. Our alarm.
I auscultate the breathing sound of patient. I did not hear any abnormal sounds. I haven't observed any crackles, wheezing, and pleural friction drop. And also, there is no presence of cigarettes or surgeries. So, yun lamang naman po, ma'am. Thank you so much for attending our session or our assessment for today.